Okay, I want to switch gears again. I want to talk about risk, like suicide or harming others.
Okay.
I know all these things don't apply to everybody, but I want to make sure I go through and ask certain questions. Is that okay?
Okay.
All right. Have you ever had a suicide attempt?
No.
No.
No. It's a sin to kill yourself. Only God can take your soul away, so no, can't do that.
All right. So no attempts. Have you ever had thoughts of suicide?
I mean, sometimes when I get really sad, I think that the world would be better without me, but I bring myself out of that. I don't think it's anything I'd ever do, but
All right. Not something you ever do, but sometimes
yeah.
a thought crosses your mind like that.
Yeah.
Do you remember the last time a thought like that crossed your mind?
When we were getting evicted from our last place, because I just felt like a complete failure.
How long ago was that?
That was about a month and a half ago. Yeah, my friends in the house turned against me because I couldn't pay rent. And it had been like the third month, but like not consecutively, so I didn't see the big issue.
Mm-hmm.
And so they told me that if I didn't get out, they would call the police. And I had to stay with my sister, and then I felt like a failure. I felt like a failure to myself, to my kids.
So it was a tough time for you.
Yeah.
So you had sounds like maybe passing thoughts.
Yeah. But like I said, it's nothing I could ever do. Ever.
If that ever changes, would you tell me?
Yeah. I'll tell you.
All right. So how about harm to others? Meaning, do you ever feel like you have thoughts, or do you ever develop a plan to hurt someone else?
When I was younger, not anymore.
When was the last time?
Probably when I was in high school.
All right. So a while back.
When I was still in that like violent stage in my life where I would fight, but it never went to anything like I'll kill this person. It was always just I'll knock you out, but I won't kill you.
All right, that was a while ago. So,
Yeah.
But presently, no thoughts of harming anybody else.
No, if I ever feel really really angry, I just I'll punch a wall. I have like special plates that I'll throw on the ground and break them.
Mm-hmm. Like the suicidal thoughts, if thoughts of harming others do come up, would you tell me about those?
Oh yeah, I don't want to go to jail over hurting somebody, so I'd tell you.
All right. Thank you. Have you ever heard or seen anything that other people have not heard or seen?
No.
Never? How about under the influence of drugs?
Well, when I used to do cocaine, sometimes I would like think that somebody's at the door and they're not at the door, nobody's there, or think somebody's in the house when there's nobody in the house.
Mm-hmm. But not under the effect of drugs. It never happened.
No.
Okay. Got that. All right, so I want to switch gears again. I want to talk about, if you're okay with this, the goals for counseling.
Okay.
Right, so the goals that you want to meet by spending this time with me, with treatment, and your general goals, like your goals in life.
Okay.
So let's start with, if you're okay, your goals in life in general.
Guess I haven't really thought much about it, but I would like to just have a real, I don't care what the job is, just a nice, cushy job.
Better job?
Yeah, where I can just relax. My kids will have a good future. I'll have a good future.
A better future for your children?
Oh, yeah.
Any other general life goals?
I guess be drug-free. Like I said, I'd really like to quit, but it's hard.
All right. How about goals specifically for counseling? Like what you hope to get out of this counseling?
I'd like to learn to be less angry,
Mm-hmm.
and bring my blood pressure down a little bit. Sleep more,
More sleep,
eat less.
eat less.
And I guess try to quit. Try to quit drugs.
Quitting drugs.
Mm-hmm.
How confident right now are you that you can meet these goals? Specifically the counseling goals?
Like, kind of, I guess. Is that an answer?
What's the answer?
Kind of.
Kind of confident?
Yeah, I mean, like I said, I haven't really moved forward anywhere, and every time I go to a counseling place, so. I mean, I'm willing to give it another shot, but because of my history with it, didn't really go anywhere in the first place, but I'm willing to try again.
All right, so you're kind of confident and willing to try again.
Yeah.
All right. So throughout this intake, I've asked you a lot of questions. I want to thank you for answering them. Do you have any questions for me?
No, not really.
So the next time I see you, it's all right with you, it'll be about a week,
Okay.
and we'll start with the actual counseling sessions. Right, so I'll still have some questions, but not as many as I've asked today.
Okay.
All right. Does that make sense, how it's structured?
Yeah.
All right, so we've completed intake. I'll still have some more questions, but we'll get to the counseling sessions. Next week, we'll get started working on the specific details of what's happened to you and what might be causing it and how we can treat it.
All right.
All right. So I appreciate, again, you taking this time and answering these questions, and I'll see you next week.
All right. Thank you.
Thanks, Rhonda.